I've got chest pain. I'm struggling to breathe right now.
Excruciating headaches, tinnitus.
Legs feel like lead.
I can't concentrate.
I still can't go to work.
I don't see my friends, I don't see my family.
I am totally beat.
It's just horrific. It really is. It's awful.
The debilitating impact of long COVID, both physical and mental, with such a wide range of symptoms. There are thought to be about 1.2 million people with long COVID in the UK. Now, the health service couldn't possibly have anticipated this, but it has come at a time when it is under severe pressure with serious staff shortages, and not just doctors and nurses, but the allied health professionals, physiotherapists, occupational therapists, the very people who could help those with long COVID. And that, in turn, means longer waits for them to receive help. Gary Loftus is an army veteran, a passionate paddleboarder, a keen walker, a hospital porter. Now there are days he can barely climb the stairs.
Shortness of breath, chronic fatigue, cognitive impairment or neurofatigue, states of dizziness, states of heart palpitations, nausea, dizziness, muscle fatigue, joint ache. There's not a day that goes by which I don't have to think about the next day going into it.
Gary had COVID in December, but it took until April till he first got some help.
January, February and March, which was the worst times I'd ever felt in my life, the only help I had then, apart from the love of a very loving family, was me trying to look for a self-diagnosis on Google or researching everything I possibly could. And it wasn't the big defining moment of help was when I emailed Long COVID SOS and I got a reply back. A, I realised I wasn't alone, and B, the knowledge I then got from a further support group was the sort of the defining moment of the fact that, you know, yeah, I'm not alone, here's some knowledge, and I'm getting it from not GPs, not medical professionals, but people in exactly the same boat that I was.
He doesn't blame anyone, especially not his GP, and compared with some, he added, his referral was relatively quick.
I'm going to get you to put your hands across your chest and I'm going to time a minute.
This was a long COVID clinic unveiled last December at University College Hospital, London. NHS England has now opened 90 clinics or assessment centres. But one charity says a third of people referred for help are now waiting for more than 15 weeks.
They need a faster route to help and support. We also found that there didn't seem to be much difference at times between people who were hospitalised with their COVID and those that weren't in terms of the patterns and persistence of their symptoms. And often the people that weren't hospitalised had to fight or are having to fight pretty hard to get access to a specialist assessment clinic.
The NHS said the majority received their first referral in 10 weeks. But GPs, those at the front line, say they are being hampered by staff shortages in the community.
So the rehab services like physio, like community rehab, occupational therapy services are a really important component of helping people to get better more quickly when they have long COVID symptoms. There's good evidence that it works, and the lack of access to them is a major problem for us in general practice, trying to look after these people, many of whom are really quite debilitated, unable to work, unable to go shopping, unable to look after their children.
Northern Ireland has just opened long COVID clinics, but there are none so far in Wales and Scotland. Gary Loftus had 6 weeks of respiratory physiotherapy. Now he manages, pacing himself, but it is hard.
It doesn't matter how positive you are. You know, you can be as positive you want. This isn't going to be solved by mental power or positivity enough. You know, there is bad days that are out there and you just have to manage them.
Well, I've been speaking with Professor Nick Lemoine, one of the doctors leading the UK's efforts to understand and develop treatments for long COVID. I began by asking him if it was possible to say what proportion of people who have suffered from coronavirus have long COVID.
Well, the experience so far has been that at least 1 in 10 people who've had COVID are still suffering symptoms, at least 3 symptoms, more than 12 weeks later. And some people are suffering symptoms that go on for 16 or 17 months. So the number of people out there suffering with this is very, very substantial indeed.
But that therefore suggests that treating it is a tremendously difficult and possibly even hazardous task for the staff who have to work through it.
We don't yet really know how to treat it. So many of the studies that are ongoing at the moment are trying to understand the mechanisms involved. We're beginning to see some interesting results that might help us to select treatments that could be effective against this disease. But for the first year, we were really groping in the dark, but now we are starting to see the light.
Does the health system have the money it needs to treat long COVID?
The NHS has set up more than 80 clinics for long COVID management across England, and there are springing up across the other nations too. But the number of cases that are needed to be seen is substantial and probably beyond the current capacity of the services.
Has your research been able to determine why some people get long COVID?
That is still unknown. We do know that it's more common in women, and particularly in middle-aged women. And there do appear to be differences depending on how old you are and your other circumstances. But it's too early at the moment to say precisely.
But are we as a country behind the curve on long COVID?
I don't think so. The scale of the studies that we're running here equal those anywhere else in the world. And the power of the NHS to be able to coordinate those across the whole country. Every single trust is involved in COVID research at the moment, and a very large proportion of general practices too. That being able to bring that firepower to bear is something that most other countries can't do.
At what point would you hope that you'll be able to tell us what we're really dealing with and how we can deal with it in terms of cure?
Well, some of the studies that started in January are already starting to read out results. So, John, I'm confident that within 6 months, we'll have a much, much better understanding of what this disease is. And very shortly, possibly before the end of 2021, the first studies looking at potential treatments for long COVID in people who've had the disease and hadn't needed to be admitted to hospital will be underway and starting to recruit patients.
Professor Nick Lemoine, thank you very much indeed for talking to us. Thank you.
Thank you.
Well, as Victoria made clear in her report, shortage of trained staff is affecting every part of the NHS. And today, a move to oblige the government to publish an independent assessment of staffing every other year was defeated in Parliament. The amendment, tabled by the chair of the Commons Health and Social Care Committee, Jeremy Hunt, failed to win government backing, despite many healthcare groups expressing support for the idea. When I spoke to the former Health Secretary this afternoon, I asked him how his solution would work.
Well, it's very straightforward. We don't train enough doctors and nurses. There are lots of people on the NHS front line, not just doctors and nurses, but other health professionals who are really feeling pressure at the moment. And the one thing we can do, and we could have done in this bill, is to reassure them that even if we don't have a solution for next Monday, we are training enough of them for the future, and the pressure will ultimately ease. And the way I wanted to do that was to have an independent body that just says every couple of years, this is how many doctors, nurses, other professionals we need to be training. And I think that would create a discipline, because the timescales are so long that without that discipline, there's always the risk that this goes to the bottom of the list of priorities.
The problem is the government doesn't look like it's backing your amendment. Why do you think that is?
Well, I think that they wrongly are worried that it will lead to extra cost if we then end up having to train many more doctors. And we will end up having to train more doctors. It will cost more, but for every new doctor, that is one less locum doctor that we have to hire. They're much more expensive. They're much less good in terms of patient care.
Well, we're also reporting tonight that staff shortages are having a real impact on people who are suffering with long COVID, more than 1 million people now in the UK. One charity said to us that 1/3 of people referred for help are now waiting for more than 15 weeks. How concerned are you about that?
Well, I'm really concerned about that, and I'm particularly concerned at the nearly 400,000 people who've had long COVID for a year. I mean, just imagine how debilitating that is, particularly symptoms like chronic fatigue that just make it absolutely impossible for you to go about your daily life. It's a perfect example of the workforce problem, because if parliamentarians, if you through your reports put pressure on the Department of Health to do more on long COVID, they probably will, but they'll only do it by diverting doctors, nurses and other professionals from other areas that will then have their own shortages, which is why today, I'm afraid, was an opportunity missed to reform the way we do this.
Well, so much of what we're talking about comes down to money. You abstained on the social care cap vote. There's now a Lord's rebellion brewing on that. Do you think the government will continue to insist that it's too costly to alter this policy, or do you think they're going to have to think again?
Well, I think they are likely to stick to their guns on the social care cap issue. What I would say about money, though, is that the priority in terms of the social care sector is more money, must be more money for local councils to perform their statutory duties, and indeed to address the workforce issues in the social care sector.
If you just stand back and just look at the government's performance over the last few weeks, whether it's the social care rebellion, the HS2 U-turn, the Channel migrants crisis, and then yesterday, Boris Johnson's speech to the CBI where he lost his way, are you a bit worried about the Prime Minister?
I don't think it's been a good patch. I don't think anyone would pretend otherwise. I think it's fairly normal for governments to go through these patches. What will matter in the end is, are the policies of a Conservative government making a difference to ordinary people and their lives? And that's why making sure that we deliver on the NHS, for example, matters, because people know they're paying more through the health and care levy. They want to see that translate itself into better services on the ground.
You stood against him for the job. Do you look now at what he's going through and think, well, thank God I didn't get it?
Sometimes, because it is a job. I mean, can you think of a single Prime Minister in living memory where the job has ended in a positive way? It's a really horrible job from that point of view. But I also think that Prime Ministers, including Boris Johnson, have had very big successes too. We have got one of the best vaccination programmes in the world. There have been some successes, and I'm sure there'll be more, and that's really what we need to get on with delivering.
Jeremy Hunt, thanks very much.
Thank you.